Factors contributing to Mr. Patrick's respiratory symptoms include COPD, anemia, which is low hemoglobin levels, left-sided heart failure, and his past history of smoking. Furthermore, an increase in heart rate of Mr. Patrick was observed, which was 155 beats per minute. The factors contributed to his elevated heart rate included his low hemoglobin levels, low levels of HDL, and high levels of LDL in his blood, his left-sided heart failure, and his high glucose levels. The development of COPD and left-sided heart failure are independent of each other in Mr. Patrick's case. Smoking damages the air sacs, airways, and the lining of lungs. It is hard for the affected lungs to move air in and out, and this causes dyspnea. This further results into COPD, which is chronic obstructive pulmonary disease. Smoking causes exacerbation and is a main contributor of COPD. Left-sided heart failure, whereas, is frequently associated with low hemoglobin levels, therefore anemia. Decrease in hemoglobin concentration will inevitably decrease the potential oxygen delivery, which decreases the blood viscosity. Thus, the hemoglobin levels are directly linked with oxygen carrying capacity of blood. The decreased hemoglobin levels results into decreased oxygen in blood, which puts more workload on the heart, which further results in weakening of left valves causing heart failure. In case of Mr. Patrick, the left valves of his heart became weak due to increase in workload, causing left-sided heart failure. Further, his LHD and HDL, potassium and sodium levels in his blood contributed to the worsening of his condition. The developing features of COPD and left-sided heart failure included fatigue, frequent cough, dyspnea, and his swollen legs.
Right side heart failure usually occur as a result of the left side heart failure. In right side heart failure, the lower right chamber of the heart, that is right ventricle, cannot pump blood to the lungs as fast as it returns from the body through the veins. Blood then engorges the right side of the heart and the veins. Fluid backup in the veins is forced out into the tissues, causing swelling as seen in the case of Patrick. Heart failure of the right ventricle often is caused by abnormalities of the heart valves and lung disorders such as COPD. Thus, in short, we can say that right side heart failure is the condition where right side of the heart cannot eject blood, thus cannot accommodate all the blood that normally returns to it from venous circulation. Right side heart failure, also known as backward failure. High sodium level. Due to heart failure, the heart is unable to pump enough amount of blood. Then heart tries to make up from this by becoming larger. Thus, by becoming enlarged, the ventricle contracts more strongly and pump more blood. When this change occurs, the heart chamber becomes larger and the muscles of the heart become thicker. Also, the heart compensates by pumping more often to improve blood output and circulation. The kidney tries to compensate for the falling heart by retaining more salt, that is sodium, and water to increase the volume of the blood, so which result in the high level of sodium in the blood test result. High potassium level. Eventually, as the condition worsens over the time, these measures are not enough to keep the heart pumping enough blood needed by the body, so kidney often becomes weak under these conditions. Thus, the dysfunctioning of the kidney result into the high blood potassium level, as now kidney is unable to remove the waste products from the body or filter the blood properly. That's why there is a high increase in potassium level. High potassium. Low hemoglobin anemia is a condition in which the body has fewer red blood cells than normal. Red blood cells carry oxygen to tissues and organs throughout the body and enables them to use energy from food. With anemia, red blood cells carry less oxygen to the tissue and organs, particularly to the heart and brain, and those tissues and organs may not function as well as they should. Thus, when kidneys are diseased or damaged due to heart failure, kidneys do not make enough erythropoietin, known as EPO. As a result, the bone marrow makes fewer red blood cells, causing anemia. When blood has fewer red blood cells, it deprives the body of the oxygen it needed. Low level of calcium due to kidney dysfunction, which further result in more calcium excreted in urine and makes the kidney less able to activate vitamin D. High glucose level. High glucose level is due to COPD, as COPD was viewed as increasing the incidence of diabetes due to its effect on psychological change like inflammation, resistance to insulin, and weight gain. The presence of diabetes was seen to increase the occurrence of lung infection and worsen COPD symptoms, causing an increase in flare-ups. So this is the reason that there is such an increased glucose level, which is mainly due to a COPD. Effect on neurological function. Firstly, calcium. Calcium plays important role in regard to nervous system functioning as cell signaling. Calcium is important in the contraction and expansion of blood vessels, nerve impulse transmission, muscle contraction, and hormone production. In muscle cell, nerve ending release calcium ion which binds to activator proteins. The activator proteins initiate the complex process of muscle contraction and allows the muscle to move. Without calcium or low calcium level in muscle would not be able to contract and relax, so the brain and body will unable to initiate or regulate the process. Effect on neurological function. Firstly, calcium. Calcium plays important role in regard to nervous system functioning as cell signaling. Calcium is important in the contraction and expansion of blood vessels, nerve impulse transmission, muscle contraction, and hormone production. In muscle cell, nerve ending release calcium ion which binds to activator proteins. The activator proteins initiate the complex process of muscle contraction and allows the muscle. High level of potassium will result in diminished deep tendon reflexes or decreased motor strength. In rare cases, muscular paralysis and hyperventilation may be observed in case if we have a higher level of potassium. On the other hand, high glucose level can cause blood vessels to be less responsive to the ebb and flow of demand in different parts of the brain. Normally, flexible vessels will swell slightly to increase blood flow and oxygen to areas that are more intensively active, such as regions involved in memory or higher reasoning during intellectual tasks. But high blood sugar level can make these vessels less malleable and therefore less responsive. Thus, with diabetes, the vasodilation ability is reduced, so Patrick will be having a fewer resources to perform any task. The one additional thing that needs to be added in this blood test result is the urea, and this would likely to be abnormal. The expected abnormality of the urea will be high in the blood, as heart failure may be described as right side heart failure or left side heart failure. The kidneys filter fluid and waste products from the blood into the urine, but when the heart cannot pump adequate amount of blood, the kidney malfunction and cannot remove excess fluid from the blood. So as a result of